You're watching 180 Degrees live in Africa. Thanks a lot for joining us. If you just did, the migraine headache leaves millions of people in pain and unproductive for hours yearly. Several millions of people across the continent suffer from migraines, up to at least 5 million of them being in South Africa. Headaches cost the economy of countries hundreds of millions a year in lost productivity. But there's good news, and medical research have made a significant breakthrough in understanding the causes of migraines by identifying the genes and mutations that trigger this form of headaches. Dr. Elliot Chevelle, the chairman of the South African Headache Society, is in the studio to help us understand the nature of migraines. Dr. Chevelle, you've presented 2 papers at the World Conference and published 14 scientific papers in South Africa. I hope we can have some good discussions on what came out of that. Thank you for joining us.
Thank you, Devin.
What is a migraine headache, and how does it differ from a normal head pain?
A migraine headache is usually described as a headache that results from dilatation or stretching of the arteries in the head. And these arteries have got a tremendous nerve supply in their walls, and when the walls of the artery stretch, those nerves send pain signals to the brain, and that's what causes the pain of migraine.
What are the symptoms and characteristics, and how would I know that I'm not just having a usual headache, but I'm having a migraine headache?
Migraine, there are certain characteristics that occur more often in migraine headaches than in others. You can get all of these symptoms in all headaches, but in migraine they are common. There's nausea and vomiting. People are sensitive to light, sensitive to noise. The pain is very severe. It is most commonly one-sided, but it can be on both sides. It's usually a throbbing headache, but it can also be not throbbing. But if it's throbbing one-sided, you're nauseous, you have light sensitivity, and sometimes if people have an aura, that's before the pain starts, they get visual problems, they see spots in dark areas, and then you've probably got a migraine.
Now, many of us, and I must say including myself, normally respond by saying nothing helps when we ask what's wrong. Why has treating migraines been such a challenge, or is it just a perception?
Treating migraines has been a challenge because people haven't really known where the pain comes from. These breakthroughs that you mentioned, they are certainly breakthroughs, in that it's going to lead to a better understanding of how this problem happens. But they're not that practical at the moment. It's very early days, and it's going to be many years before they show any results. And the results that we think will happen is that people will be able to develop more efficient medication, better drugs to deal with the problem. But there are far more exciting breakthroughs in the migraine treatment. And the most important one, if I can just describe, I mentioned that migraine is because of the dilatation of the blood vessels. Now, most people and most headache specialists believe that it's the blood vessels in the brain which are dilating and where the pain comes from. And the big breakthrough that we have made at the Headache Clinic is to be able to prove without doubt that the pain actually comes from the little blood vessels in the skin, in the scalp. Now you can imagine if the pain comes from the vessels in the brain, you can't get to them, apart from with medication. But if the pain comes from the vessels in the skin, and in some people, when they have a headache or a migraine, you can actually see the little vessels standing out. They dilate. You can get to them. In many people, it just means that one has to cauterize the vessel, and that's a permanent cure. So and this is happening at the moment. So that's a breakthrough that is really significant, I believe.
That is a major change in the school of thought.
Absolutely.
How is that, you've mentioned something about treatment, but how exactly does that affect treatment of the average headache sufferer?
Well, in people who have vascular headache, in other words, migraine, and if no other treatment works for them to prevent it, it's then possible to identify which arteries in the scalp. And it's got nothing to do with the brain arteries. I must just make that clear. There's no danger. Once we identify which arteries And it's quite easy to do that if you see a patient while they're having the pain and you press on the artery and close it. The pain goes away immediately. If you take your finger off, it comes back. You then know that you can actually cauterize or tie off that artery and the pain will not come back. It's a permanent cure.
Dr. Elias Schavel, the chairman of the South African Headache Society, thank you so much for joining us and shedding some light on that subject.
It's a great pleasure.
We'll take a look at more news coming up after the break. But first, weather.